Hi guys, my name is Nikita Sandhu and today I'm going to present my topic in foodborne illness prevention with some tips of safer practices for consumers. So, foodborne illness occurs when contaminated food or beverages are consumed. The Federal Food and Drugs Act in Canada is a comprehensive set of laws and regulations designed to protect public health by ensuring food safety. It sets rigorous standards for food production, processing, packaging, storage, and alternation, controls coloring and additives, set bacterial standards, and regulates manufacturing condition and distribution practices. So, foodborne illness pose significant public health risk, especially in vulnerable populations like young children and the elderly. Preventing these illnesses can prevent public health and reduce healthcare costs, which can be substantial. By reducing the strain on healthcare resources and minimizing treatment costs, we can ensure the well-being of individuals and communities. The idea behind foodborne illness prevention is to lower the risk of foodborne infections, commonly referred to as food poisoning. By implementing a number of policies and methods, it promotes safe handling, preparation, and consumption while reducing the risk of food contamination. So in this slide, we'll see that the stakeholder responsible for ensuring food safety and preventing foodborne illness include consumers who should follow cooking instruction and expiration dates and food handlers and service workers, including chefs, cooks, servers, kitchen staff, and food service worker in restaurant, caterers, and catering services too. Food producers and processors should follow stringent hygienic and sanitization procedures. This involves following the guidelines set out by HACCP and GMPCs. Regulatory agencies are in charge of managing food safety inspections, keeping an eye on compliance, and handling outbreaks of foodborne illness. So, in this slide, we'll see public health authorities work together to safeguard the public health with regulatory bodies and healthcare providers. Managers and supervisors responsible for food safety, they are essentially in encouraging a culture of food safety and inside the company. Foodborne illness prevention is crucial for public health as it reduces illness, hospitalization, and deaths associated with the contaminated food. It also safeguards consumers, especially vulnerable groups like children, the elderly, pregnant women, and those with weakened immune system. Ensuring food safety and preventing illness is essential for consumer satisfaction. Our common foodborne pathogens comes under bacteria, viruses, parasites. E. coli, Salmonella, Listeria comes in bacteria. Norovirus hepatitis A comes under viruses. Giardia, Cryptosporidium comes in parasites. So there are three risk factors we should understand. First is cross-contamination, in which proper handling of raw and cooked food should be there. Second is temperature control. Cooking food to safe temperatures is mandatory. And third is personal hygiene, in which hand washing, proper attire for food handlers should be mandatory. In this, we'll see some prevention procedure. Good hygiene practices are crucial in food establishments like restaurant kitchens, cafeterias, and processing facilities. Hand washing hands frequently with soap and water, wearing clean clothing, hair nets, and protective gear, especially before handling food. After using the restroom and touching contaminated surfaces is essential to prevent contamination. Is sanitization and cleanings. Regular sanitization should be conducted before, during, and after food handling activities at scheduled intervals throughout the day. Targeting all food contact surfaces, utensil equipment, and preparation areas, surfaces should be cleaned with hot soapy water and sanitized using approved sanitizers. Proper procedures should be followed, and cleaning supplies should be stored and replaced regularly. Third is temperature control. Temperature control measures are crucial in food establishment, including refrigerator, freezers, cooking equipment, hot handling unit, and food service counter. Food should be stored at safe temperature to prevent bacterial growth and spoilage with refrigerators set as 40 degrees Fahrenheit and freezers at 0 degrees Fahrenheit. Cooked food should be cooked appropriate in internal temperature. Fourth, education and training. Regular food safety education and training should be provided to food handlers, managers, and other personnel, covering topics like personal hygiene, sanitization practices, temperature control, food handling procedures, and regulatory compliances with interactive elements for reinforcement. Fifth, food handling and storage. Consistent food safety handling practices are essential in all food handling areas, including kitchens, pantries, storage areas, and serving stations. Proper storage prevents cross contamination and separates raw meats from ready to eat foods, and ensures airtight container prevent contamination and spoilage. 6. Regulatory compliances. Regulatory compliance is a continuous requirement for food establishment encompassing of all food operations. It involves staying informed about regulations, implementing policies, conducting regular self-inspection audits, and promptly addressing deficiencies to maintain regulatory compliance. Constantly improving the prevention of foodborne illness. Routinely reviewing food safety policies and procedure should be there, and taking regulatory agency comments and revision into consideration is important. In the end, we should understand that foodborne illness and their prevention is crucial for protecting public health. Education, proper handling practices, and collaboration with regulatory agencies are essential for reducing the incidence of foodborne illness outbreaks. There are three test questions I have for you guys. Name three common foodborne pathogens. What are three risk factors contributing to foodborne illness? And how can consumer be empowered to prevent foodborne illness? I hope you guys know all the questions. Thank you so much, guys.